Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I shared with you how to stop being held hostage by the intensive care team if your loved one is critically ill in intensive care. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to share with you the 5 ways how to overcome the most challenging situations in intensive care if your loved one is critically ill. If you have come to this blog and this video, chances are that your critically ill loved one has been admitted to intensive care, and chances are that your critically ill loved one is not in a good place. Chances are that if you are watching or listening to this right now, that you are not in a good place either. You all of a sudden have realized that by having a loved one critically ill in intensive care, your life, the life of your family, and the life of your critically ill loved one have changed in an instant. You and your family have literally been hit with a once-in-a-lifetime challenge that you can't afford to get wrong. Your level of frustration, your level of emotional pain you are experiencing, the fear of the unknown, the anxiety, the stress, and the overwhelm, your vulnerability, and by you and your family just being so far outside of your comfort zone makes this experience of having a loved one critically ill in intensive care almost unbearable. And no, I'm not talking about your loved one being admitted to intensive care for an overnight admission after they had a planned operation that required overnight monitoring in intensive care. I'm talking to you about the most challenging situations that there can ever be in intensive care, that are literally life-changing, challenging, exhausting, extremely frustrating, and demanding. I'm talking about the situations where your critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or your loved one might be having a severe or traumatic head or brain injury. Your loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or your loved one may be in a situation where the intensive care team is suggesting a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one. Or your loved one may even be approaching their end of life in intensive care. Those are the situations in intensive care that are the most challenging, and those are the situations where your critically ill loved one needs you, needs your advocacy, needs your strength, and needs your stamina in order to face this challenge effectively. Now, if you are like 99% of families of critically ill patients in intensive care, who have no peace of mind, who have no power, no control, and no influence, you are so paralyzed by your fear, by your frustrations, and you're also paralyzed by your overwhelming emotions that you just passively witness this event as a passive bystander rather than proactively looking for a solution. In order to effectively deal with the most challenging situations there can ever be in intensive care, and in order for you to have peace of mind, control, power, and influence, in order to get results, and in order for you being able to effectively manage this once-in-a-lifetime challenge and get the outcomes and the results that you want and deserve for your critically ill loved one, I want to show you the 5 ways how to overcome the most challenging situations in intensive care if your loved one is critically ill in intensive care. So let's get right into it. Number 1. Throw out all of your preconceived ideas and preconceived notions about intensive care and start thinking differently. If you are like 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence, you usually come wired with preconceived ideas and preconceived notions such as, this is really bad, why is this happening to me? Or you might tell yourself, I can't control what's happening. Or you might say, I don't understand intensive care. Or I better don't ask too many questions because I don't want to look stupid. Or you might say, I have no idea what the intensive care team is talking about. Or you might say, in order to have any influence in this situation, I need to be nice and I need to suck up to the doctors and the nurses. But here's the deal. In order for you to have peace of mind, control, power and influence, you need to throw that thinking of the 99% out of the window now. You need to adopt a very different mindset very quickly, and you need to look at what the 99% of families of critically ill patients in intensive care are doing who have no peace of mind, no control, no power and no influence. And you need to do the complete opposite of what they are doing. That is what will set you apart. It is what will give you leverage. It is what will communicate to the intensive care team that you will do whatever it takes to have peace of mind, control, power and influence, and it will set the scene for you and the intensive care team so that they know they are dealing with a powerful family. Number 2. You need to adopt the belief system that this is a temporary challenge that you are dealing with. And you need to adopt the belief system that you can have peace of mind, control, power and influence no matter how big the challenge you are facing. You may have heard me saying this before. Beliefs can move mountains. Peace of mind, control, power and influence in a situation where your critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or your loved one may be having a severe or traumatic head or brain injury, or your loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or your critically ill loved one may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest of your critically ill loved one. Or your loved one may even be approaching their end of life in intensive care. In those situations, the intensive care team is so used to being in control, they are so used to run the show, to drive the bus, so to speak, that they don't expect being challenged by a powerful family of a critically ill patient in intensive care. The intensive care team is so used to stand on this pedestal of being the perceived power and the perceived authority that it's very easy for them to drive home their mainly hidden agenda during those extremely challenging situations there can ever be in intensive care. So, therefore, your belief system that you can have peace of mind, control, power and influence, no matter how big the challenge, once your loved one is critically ill in intensive care, is your first point of difference. Change your belief system, and I bet that the intensive care team will notice. Number 3. Start questioning things. Do your own research and implement quickly what you discover. Peace of mind, control, power and influence comes from being different. It comes from going against the grain, and it comes from going out of your comfort zone. If you are like 99% of families in intensive care who don't question, who don't do their own research, who continue to suck up to the intensive care team, and who as a result of their inactions have no peace of mind, no power, no control and no influence, then you will wind up just like them. You will be a victim and you will blame other people for your situation. But I can assure you that after more than 15 years intensive care nursing experience in 3 different countries, where I have literally worked with thousands of critically ill patients and their families, that the few families who stood their ground, who had peace of mind, control, power and influence, they all had in common that they were doing their own research. They questioned things, and they questioned the approach of the intensive care team. Those influential and powerful families of critically ill patients in intensive care realized that the situation they found themselves in leaves no time for sucking up to the intensive care team. They realized that this once-in-a-lifetime situation required for them being actively pursuing their goals, and they also quickly realized that what you see in intensive care is not always what you get. Number 4, you must learn very quickly that what's happening behind the scenes in intensive care is what's driving the decision making of the intensive care team in extremely challenging situations. Now, if your loved one is critically ill in intensive care, and if they are in one of those extremely challenging situations that I mentioned before, you are not only dealing with the critical illness of your critically ill loved one, you are dealing with another massive challenge that the 99% are completely unaware of. You are dealing with an extremely powerful force that's called behind the scenes in intensive care. This is such a powerful force that if you don't get a handle on this, you, your family and your critically ill loved one are literally doomed. In whatever way the intensive care team presents and positions your critically ill loved one's diagnosis and prognosis, I can assure you that a big part of the positioning is coming from what's happening behind the scenes in intensive care. What do I mean by that? By that I mean that the financial interests of the intensive care team and their perception of whether they are going to make money or whether they are going to lose money by continuing to treat your critically ill loved one will impact on their positioning. Also, the bed management issues and bed management challenges of an intensive care unit will always impact on the positioning of the intensive care team. For example, does the intensive care team have an interest in admitting other more acutely unwell patients into in-demand, precious and expensive intensive care beds where they think they have a much bigger interest in treating them instead of your critically ill loved one? Also, the intensive care team's medical research interests. For example, is your critically ill loved one a candidate for medical research? Medical research attracts millions of dollars per year from pharmaceutical companies, from universities and even from government agencies, and the money is being used to conduct medical research on real people. If your critically ill loved one doesn't fall into a medical research category, the intensive care team may have a lesser interest in continuing treatment and not give them the best and full treatment. Also, the politics, the dynamics, the competing interests, the power play and the power struggles, the intrigue, the hierarchy and the psychology in intensive care, one way or another always impacts on the positioning of the intensive care team, of your critically ill loved one's diagnosis and prognosis. Last but not least, number 5. You must arm yourself with insider and behind the scenes knowledge very quickly, so that you can get peace of mind, control, power and influence. Now, whenever I faced a new challenge in life, I basically had two and always will have two choices. Number 1, I try and figure out on my own through trial and error. Or number 2, I learn from someone who knows what to do and who has been there before. In your unique and extremely challenging situation, I would certainly choose number 2, and I would learn from someone who has been there and who knows what to do. To live through an impossible situation, you don't need to have the reflexes of a Grand Prix driver, the muscles of a Hercules, the mind of an Einstein. You simply need to know what to do. This is a quote from Anthony Greenback from the Book of Survival. In order for you to live through this impossible situation where your loved one is in intensive care facing the worst challenges there can ever be, you simply need to know what to do. So, how can you do that? And how can you quickly get peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what's really happening in intensive care and how you need to manage the doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.